The different blood vessel types, we're going to look at kind of some major categories, but the different blood vessel types have different blood pressure needs, and that will determine the thickness of their wall as well as their overall composition. There are three tunics that exist in most blood vessels: the tunica intima, media, and adventitia. The intima is the innermost component of a blood vessel. It's synchronous with the endothelium or simple squamous epithelial tissue, and it has some loose connective tissue as well. The tunica media is smooth muscle, and this also can secrete collagen and elastic fibers, and the elastic fibers can bundle if needed when abundant. And then the tunica adventitia is the outside component. It is dense, irregular connective tissue, and it also contains nerve supply, the nervi vasorum, and blood supply, the vasa vasorum. Now, the type of blood vessels include veins, venules, capillaries, arterioles, and arteries. Veins, there's large and medium, and they are involved with collecting and returning blood. Venules, these are post-capillary beds, and they help with extravasation of fluid, so moving fluid back and forth from the interstitium inside of the actual lumen, as well as extravasation of leukocytes, of our white blood cells. Capillaries, there's three types: continuous, fenestrated, and sinusoids, which are involved with metabolic exchange. Arterioles, specifically meta-arterioles, regulate blood flow. And arteries, there's elastic, muscular, and these help with distribution of blood overall. Our elastic arteries would be like our aorta and pulmonary arteries. The tunica intima has a prominent elastic layer. The media has a very thick, smooth muscle layer that has multiple sheets to help maintain blood pressure during diastole. And the adventitia, it has a thinner media that is essentially, it's thinner than media. And so it's going to provide some protection, but not as much as we would expect the media to provide. Our larger veins, like our vena cava, contain some elastic fibers that are located in the tunica intima, but no lamina. There is then a tunica media that has a more thin, smooth muscle layer with a few elastic fibers, and an adventitia that has it's thicker than the tunica media, and it contains both longitudinal and spiral bundles of smooth muscle in this layer. Our venous valves, we have medium and large veins that have valves that prevent retrograde blood flow. The valve will consist of a fold of tunica intima, which extends into the lumen of the vessel, as we can see here. Our muscular arteries have a prominent internal elastic lamina. They also have a visible coiling of this layer when the artery is contracted. The media contains thick, smooth muscle with some elastic fibers and a prominent elastic lamina. And the adventitia has medium to small size arteries, which are distributing arteries, will contain this, and it typically has a round lumen. Medium veins will see elastic fibers with no internal elastic lamina. The media has a thin, smooth muscle layer with some elastic fibers. And then compared to equivalent arteries, it has thinner walls, the adventitia, and there's a irregular shaped and a larger size lumen, as seen up here. Arterioles have no internal elastic lamina and no visible coiling. They contain 1 to 3 layers of smooth muscle cells with some elastic fibers. The tunica adventitia is a very thin layer of connective tissue and a rounder lumen. Venules are going to have no internal elastic lamina, no visible coiling. They have a thinner tunica media than the arteriole, and they have a thicker adventitia than its tunica media. They have a larger lumen and a thinner wall than equivalent arteriole with an irregular shape. And lastly, our tiny little capillaries have just a tunica intima. This contains endothelium and a basement membrane only. Capillary beds can communicate from one side to the other. Typically, we see arterioles going into capillaries, going into venules. But you can have an AV shunt, which is an arteriovenous anastomosis. That's here. It's just a connection between the two. You could also have an arterial capillary arterial connection. That'd be an arterial portal system. Or you could have a venule capillary venule system. That's a venous portal system. Capillaries themselves have different structural linings depending on where they're located and what their function is. Continuous is the most common. There are these intracellular clefts to allow for diapedesis. Fenestrated has holes in the surface to allow for better movement of substances. This is seen in the kidneys, in the glomerular filtration rate or glomerular filtration system. And our sinusoids have incomplete basement membranes as well as these intracellular gaps, which allow them to be more holy so cells can move freely inside and out of them. So a continuous capillary, there's no pores or gaps in the endothelial cytoplasm, but a highly selective barrier, and we see this in the lung, the brain, and the testes. A fenestrated capillary, the endothelial cells contain small pores that are called fenestrations, and it has a slightly selective barrier. We see these in the kidneys and the intestine. And then our sinusoids are really discontinuous capillaries. There's large gaps in the endothelial cytoplasm, incomplete basement membranes, and this is allowing for larger passage of molecules as well as even small cells. And so we see this as a poorly selective barrier. So this is used in the liver, the spleen, and bone marrow. On top of our capillaries, we have these pericytes, which are stem cells that have long cytoplasmic processes that extend around the capillary cell itself. And they help with blood flow control, blood-brain barrier access, angiogenesis, and muscle regeneration. And that's all for today. And for this week's information, continue to go through your activity and your quiz.